Commissioner at the Chicago Department of Public Health. We're here to do the weekly COVID-19 update. I'm joined by CEO of Chicago Public Schools, Pedro Martinez, as well as Medical Director at the Chicago Department of Public Health, Dr. Geraldine Luna. So we have a lot of good news to share again this week. First of all, the travel advisory does continue to apply to the whole country. And just as a reminder, this is the 5th consecutive week that all U.S. states and territories are on the travel advisory. And even while the news is getting better from Omicron, it's important to keep that in perspective, that the risk does remain high across the country. However, we're getting closer. This is Chicago's daily COVID case rates. And you can see back in late December, as we started to peak here, we were averaging 42.5 cases per 100,000 per day. We got up as high as 177. We're back down to 38. We only have to get to 15. That's kind of what we're aiming for here in terms of being able to, where we take states off the travel advisory, where we come out of that higher risk setting, and the progress continues to be very good. So in Chicago specifically, we are now averaging 1,037 new COVID cases every day. That is down about 50% from a week ago. We were averaging 2,000 cases a day just a week ago. And it's the 4th week in a row that we've seen a decrease of about 50%, which is great. Our test positivity has moved from the high transmission or the high risk category all the way to the right down to lower, currently at a 4.5% positivity. Really pleased to have that back down under 5%. That's where we want it to stay. And that's down from between 7 and 8% a week ago. And then our hospital capacity is also looking much better. In terms of the number of people in the hospital in Chicago with COVID, we're currently averaging 826 there, which has moved from very high to high, and then ICU averaging under 300, which has moved from high to substantial. So we're getting lots of questions about when is it time to potentially no longer be requiring proof of vaccination for high-risk settings? When are we getting close to being able to take the masks off? We're not there yet, but watching each of these factors move to the right, down toward lower transmission each week, that's where we're heading for, and we're getting close. We continue to see the kind of progress we've seen over the last few weeks. I don't expect that it would be very long, but we will be continuing to use the same metrics as CDC recommends and as we've used all along. So what has been different with Omicron? This is the Chicago picture. One thing is that cases no longer track as tightly with hospitalizations and deaths. We've seen many more people. Cases here in blue, you can see the highest we've ever seen, but the cases don't always turn into the hospitalizations as often, and the hospitalizations really don't turn into the deaths as often, and that is largely because of vaccination. We have some other good news to share. As expected, Moderna has joined Pfizer in having full FDA approval for its vaccine. So that means no more emergency use authorization. Both Moderna and Pfizer, as expected, have that full approval. Because they have full approval, they can now start marketing the vaccine under a brand name. And I want to explain this because we've been getting questions about it. So Moderna can now market its vaccine as Spikevax. That's the name they've chosen. Just as Pfizer's, they've been marketing it as Comirnaty. There is no change in the formulation. It's the exact same vaccine. It's just like, for example, people may know Prozac. That is a common brand name drug for depression. Its regular name, that is not a brand name, is fluoxetine. When doctors write for it, we actually write for fluoxetine. So this is just the brand name that now that the FDA has given the approval, the company may market it. They actually have not been able to market it before. Let's talk variants. I know there's a lot of questions about this. So first of all, in Chicago, in Illinois, and across the US, it's almost all Omicron. 99.8% of what we are seeing is the Omicron variant. And then the other 0.2% are still Delta. We're seeing almost nothing else pick up. We've been getting lots of questions about the Omicron subvariant, BA.2, which is sometimes called the, quote, stealth subvariant, although there is nothing actually stealthy about it, and that's not a scientific term. I want to clarify clarify that we did detect it here in Chicago. That is not surprising, and it's a sign that our systems are working in terms of looking for any changes in the virus. It remains uncommon here. I do expect to see more increase among Omicron samples. So there's an Omicron version BA.1, which is the original. There's an Omicron version BA.2, which is this one. There's even an Omicron version BA.3. If we start to see a major source of concern related to this, there's a good chance it could get a completely different name. But at this point, we're counting it within Omicron. It is not clear that there are major differences in outcomes. We're following this closely. We're also not seeing new issues with vaccine effectiveness at this point. So I've not seen anything to raise the alarm about, but certainly we need to monitor it. Cases have continued to increase in Denmark, where they have seen more of this BA.2 be part of the picture there. And the decrease has slowed in the UK, possibly as the result of more of this BA.2. But in South Africa, where they are seeing a lot of BA.2, we have not seen increased cases. I'm telling you all this detail just to tell you we don't know yet whether BA.2 is going to have any kind of significant impact on our picture here. We will let you know if there is anything of significant concern, but being vaccinated continues to be the most important thing, and the protection looks good against this version of Omicron, just as it does against the others. If I had to take a guess, this is what the UK looks like. This is cases in the UK over the whole pandemic here. And you see that very big recent surge, that was Omicron. You see a very big drop off, and then you see some flattening. Do you see that there over on the right side? That suggests possibly as a result of BA.2, you stop seeing the sharp decline and you start to see some flattening. I'll be more concerned if we start to see numbers really shoot back up in the UK or in other places, or if we see this turn into more severe outcomes. We've not seen that in South Africa. We've not seen major changes in other settings. As always, we're trying to watch the places that are just a little bit ahead of us, but the bottom line is no major change. We're concerned about how our epidemic shows up here in Chicago, and the news right now continues to be very good on that front. So let's take a quick closer look at that. Our daily cases in Chicago peaked right around New Year's at almost 10,000 cases a day. So the fact that our average is now around 1,000 cases per day just in a month is amazingly fast progress. And thank you to everybody getting vaccinated and being careful over this last month. We do, though, remain in very high transmission risk level. Test positivity similarly peaked at New Year's with 20%. Our current positivity of 4.5, very good. We want to keep it there. People have been asking a lot, what about all those at-home tests that you're not counting? How do those fit in? Isn't the positivity a whole lot higher because you're not counting at-home tests? No. The great majority of at-home tests are negative. And when an at-home test is positive, typically people are often reporting that to their doctor or using the app or getting it confirmed, although there's no need to confirm it in an outside setting. And so, in fact, the at-home tests are much more likely to be reported and show up in the data if they're positive than if they're negative. So if anything, our positivity, including that, would actually be lower. But we continue to use the tests that come through the standard channels at this point. In a long-term way, we will probably as a country move more away from even cases and positivity. We'll be focusing more on severe outcomes like hospitalizations and deaths. We'll continue to monitor for variants. We'll have other ways of following disease tracking, just like we do for influenza. But for the moment, we still continue to follow these, and we're not taking it off anytime very soon. Rates of infection are declining. The Omicron variant, of course, has had greater ability to evade immunity. We have seen more people get breakthrough infections if they have been vaccinated. We have also seen many, many more people who were not vaccinated and were counting on a prior infection. We've seen that have almost no protection with Omicron, and people get reinfected. And so I just wanted to put this in some perspective. I also hear a lot of people saying, why do we bother with the vaccine? A lot of people still get COVID even if they get the the vaccine. And I want to say, first of all, that the most important thing is that people who get COVID and have the vaccine are much less likely to get seriously ill, much less likely to end up in the hospital or to die, or even to have an illness that extends beyond 5 days, which is part of why we've been able to shorten the isolation and quarantine. However, the vaccine is also the most important thing to protect against infection. Is it 100%? Of course it's not. It's never been 100%. With Omicron, we saw it drop significantly, but still, if you are unvaccinated, you are at least twice as likely to be diagnosed with COVID as vaccinated Chicagoans. So at the Omicron peak, to put this in a sense for you, the reason everybody you knew had COVID was that at the Omicron peak, about 1 of every 90 vaccinated Chicagoans was testing positive each week. That's very high. However, at that same peak, about 1 in 40 unvaccinated Chicagoans was testing positive each week. That's a big difference, although they're both high. As we've come down now, we look at last week, we were down to about 1 in 400 vaccinating Chicagoans testing positive, still relatively high. And we're at about 1 in 140 unvaccinated Chicagoans testing positive, much higher. So I don't want people hearing this vaccine doesn't do anything to protect me, it doesn't do anything to protect my family. It does, and then it does even more to help against severe outcomes. Let's talk about those severe outcomes quickly. So today is February 1st. Omicron first detected December 1st. So there have only been 2 months with Omicron. And in those last 2 months, at least 7,410 Chicagoans have been hospitalized with COVID-19, and at least 949 Chicagoans have died from COVID-19. So do not let anybody tell you that Omicron is not dangerous, that nobody's getting seriously sick, dying. They are, especially if they're not yet vaccinated. Also, I don't want to hear folks saying nobody who is younger gets seriously sick. Just in the last 2 months, just in Chicago, 740 of those hospitalizations have been in Chicagoans between 18 and 29, and 729 of them have been in Chicagoans 30 to 39. So 20% of our hospitalizations from COVID here in Chicago have been in folks between the age of 18 and 39, almost all of them unvaccinated. Deaths, thankfully, are not common in these younger age groups, but we did have 6 Chicagoans just in the last 2 months between 18 and 29 die from COVID, and 19 Chicagoans between 30 and 39. Again, almost all unvaccinated. And where we look by race ethnicity, approximately half of those who have been hospitalized in Chicago just in the last 2 months with COVID have been Black. And approximately half of those who have died from COVID in Chicago have been Black. And less than a third of Chicago self-reports Black or African American race. And that is due to a number of things. It's due to more underlying conditions. It's due to potentially access issues. But first and foremost, it is related to the fact that we still are not where we need to be, particularly for Black Chicagoans getting vaccinated. Hospitalizations are coming down nicely, as you see. Our peak was 276 new per day. We're now down to less than 100, and our capacity has also increased. As of today, we had 21% of the beds available not in the ICU across the system, and 16% of the ICU beds. So hospitals are more able to go back to elective procedures and reopen things. They're still in a surge, but things are looking much better. And again, the big difference here is that red here shows what has happened for Chicagoans who have been hospitalized and are unvaccinated. And in the same way that you're twice as likely to be diagnosed if you're unvaccinated versus vaccinated, depending on the week, you've been 4 to 7 to 10 times as likely to be hospitalized, and the same for dying. And so the red here shows the rates of hospitalization that we've seen right here in Chicago for people who are unvaccinated versus vaccinated and boosted in the blue. And then similarly, deaths, if we look throughout this peak here, this takes us from October forward, those blue lines on the bottom, vaccinated and then boosted, are almost flat. We've seen almost no increase in deaths among those who are vaccinated and boosted. Boosting, as you can see in the dark blue, gives even some more protection. Almost the entire increase in deaths in Chicago over those last 2 months is that red line, folks who are unvaccinated. So I know I sound like a broken record, but I'm a broken record who cares about saving lives. And this means, first and foremost, getting vaxxed. I wanted to give a quick update on free rapid COVID-19 tests. As you know, everybody in Chicago is eligible for 4 free at-home tests from the federal government. You go to www.covidtest.gov. I know those have started arriving in Chicago. Please order those if you have not. I also wanted to add there's a project called ACT, Access COVID Test, that the Rockefeller Foundation is actually doing in certain states across the country and prioritizing some zip codes that have been hard hit or that may have problems with accessing care. CDPH did not have any input into the zip codes that were chosen. They used a national formula. But all of these zip codes, 15 in Chicago, you can get 5 additional free antigen tests to your home. And we have more information available on our website. So we'll be lifting these zips up, and I encourage you to do that. I also just wanted to remind folks, early treatments are more and more and more available each week. The number one reason that our doctors in Chicago say they can't use them is that people are calling too late. So if you get diagnosed with COVID, or somebody in your family or someone you know about gets diagnosed with COVID right now, whether or not you are vaccinated, if they are at serious risk for being hospitalized, they're much older, they have serious underlying conditions, you're really worried about them, please do not wait. As soon as there is a positive test, even if it's a home test, I want you to call your doctor and say, do you think I should think about getting one of these early treatments for COVID? It is your doctor's decision, because there are lots of things that have to get looked at here. There can be interactions with medications. Not all are appropriate for all age groups and underlying conditions, but these are the medicines that have been shown right here in Chicago and around the world to help keep people out of the hospital if they get diagnosed with COVID. So you cannot just get these at a pharmacy. They have to be prescribed by a doctor, but we want you to call, and we have been working on building increasing access here. Our Protect Chicago at Home going very strong. You can continue to get vaxxed at home. There's a $50 incentive for first or second doses for anyone over the age of 5. We've got pediatric, adult, and booster doses available. Up to 10 people can get vaccinated at the same time. We continue to have appointments Monday through Sunday, 8 a.m. to 6:30 p.m. There is uptake all over the city here, and we have seen it be the most successful among Black Chicagoans, which is one of the reasons we've really doubled down on making more availability, and we will continue to put resources where they're most needed. I want to highlight our family COVID vaccine clinics continue. Every weekend, CDPH is doing, in partnership with city colleges, Saturdays and Sundays. We're at Truman this Saturday, Malcolm X this Sunday. Those are open to anybody in Chicago, adults, pediatrics, boosters, all welcome. We do Saturdays and Sundays, recognizing that we are often supplementing what may be happening in schools or at workplaces, and these have been going well. Hundreds of folks coming and getting vaccinated. We've been tracking what makes people who come to these clinics get vaccinated now. We've got some stuff out on social media, thanks to those who are letting us take their little stories of why now, why get vaccinated. We're hearing, my friends are vaccinated, I wanted to join the movement. We're hearing, my mom made me do it. We're hearing, I was thinking about my family. We're hearing, I want to protect myself. And we're definitely hearing about needing to show vaccine cards for dining and going to the movies, etc. And when we look at this a little more systematically, this is just a convenient sample, but when we ask what was the deciding factor, if any, that convinced you to get vaccinated now, we hear 2 main things: the vaccination requirement for restaurants, bars, and events, especially for younger people, and the increase of cases. The third thing we hear is I had family and friends getting sick. Those are the top ones. And then, did someone specific play a role in your decision to get vaccinated? Far and away, family or friend, family or friend, family or friend, family or friend. We're not hearing doctor anymore. I think most people have talked to their doctors or gotten vaccinated at their doctors. You should keep talking to your doctor if you've got questions. But families and friends are who are getting these conversations done and helping give people the confidence to protect themselves. Next, we're hearing work. Next, we're hearing news on TV. And we continue to hear loss of a family member driving people's decisions. And I did just want to highlight a little more data around this sort of vaccine requirement for high-risk settings. Again, this is not in place forever. It is in place through the surge because we know those high-risk settings can be dangerous for folks who are not vaccinated and can put additional threat on our hospitals. And I just wanted to show that really this is available on our dashboard. You can explore it. But this is showing the vaccination rates by age, first doses of vaccine. And that red line is when the vaccine requirement went into place. And what you see is a pretty notable increase in the dark blue line, the red line, and the light blue line. Those are our folks who are 12 to 17, 18 to 29, and 30 to 39, whereas we didn't see much change at all in the older groups. The green at the bottom there, those are our kids. Those are our 5 to 11-year-olds. And I wanted to point out that that vaccination rate of increase, we're already about twice as vaccinated as the national average, shows no signs of slowing down. We want to keep that up. It's what keeps our schools open and safe. And thank you for everybody who's doing a fantastic job getting kids and adults vaccinated. We hit two important benchmarks this week. 77%, you know we like Protect Chicago 77, of 12 to 29-year-old Chicagoans have now gotten at least their first dose of the COVID-19 vaccine. So that's both the 12 to 17s and the 18 to 29s. And it's been great to see that. And then finally, 80% of Chicagoans over the age of 5 have received at least their first dose of the COVID vaccine. That's a really important milestone. Public health colleagues around the country sort of look to 80% as the bottom of where we want to think about a population being vaccinated. This is just first dose, not second, but it's an important benchmark to have hit, and we want to keep moving. Our social media team has been working to turn the little deep dish pie here into some social media. So I'm gonna give it a try here. So, I have some supremely good news. It may sound cheesy, but you too can get a slice of the action and order up, please join, get your COVID vaccine, join the 80% of eligible Chicagoans that have already made that decision. I want Chicago known for this, just like we're known for deep dish pizza. As always, chi.gov/covidvax if you have any questions, 312-746-4835. The folks there will help you with whatever you need related to COVID. And with that, I will hand it over to CEO Martinez. Thank you.
Thank you, Dr. Arwady. A lot of good news. So we're going to talk a little bit more about our change to align to the CDC guidelines from going from 10 to 5 days. And I'm going to show you a little bit of detail why we need to take a little bit of time. Of course, that's effective February 1st, effective today. So you can see that if a child is test positive, you can see what has to happen. So on the 6th day, they can come back to school, but they have to keep their mask at all time. And when they have to take them off for eating or drinking, they have to be, whenever possible, 6 feet social distance from others. So that's an important operational procedure that the schools have to put in place. And so that's why we wanted to give the schools time to be able to implement that. So that's for children who test positive. If your child's unvaccinated but is exposed, very similar. Again, they can come back on the 6th day. Again, if children have to take off their masks, and this would be for eating and drinking, they must maintain 6 feet social distancing as well. Of course, we do have children that cannot put on masks, and so for those children, we would ask that they stay in quarantine for the full 10 days. And then, of course, if your child's vaccinated, and this is what Dr. Arwady and I have been saying all along, these are children that would not have to be quarantined. And so, again, vaccination is protecting our children. Their likelihood of getting COVID or having serious symptoms, again, is much less. We are working as fast as possible so that we can, again, we want to report all of our data. Right now, we're reporting at the school level. The goal is to report at the school, reporting at the district level. Our goal is to report at the school level. So just, we're working on this as soon as possible. So this is something that's, that we put a priority. Again, the goal is for us to separate cases, both from our weekly testing. I'm going to show you some stats about how many weekly tests we're doing versus our self-reporting, because we've seen a lot of duplicates, a lot of errors. So again, we want to have as accurate data as possible for our families. So again, we're working on this, more to come. So here's the great news. Our total cases for last week, you can see we're at 1,164 for students, 324 for staff, very sharp declines. We started seeing a sharp decline for staff, but and that's because so many of our staff are vaccinated, but even for students, you can see now we're at a much better place. And keep in mind, this is for the week. So put it in context, if the city is at about 1,000 cases per day, we're at about 1,100 for the week. And you can see, we had been sharing with our parents that we were going to be quarantining more students with the surge. The good news is that we're now just under 12,000 students being quarantined. That's down from close to over 19,000 just last week. So again, we have peaked there as well. Remember, this is always a lagging indicator because these are students that are still on the old policy that are still quarantined for 10 days. But the good news is the numbers are coming down very, very fast. And we have now over 91,687 consents for testing. And so the good news is that we are, those numbers continue to go up. We are very close. We're over 90% of our schools have the minimum 10% of unvaccinated students for testing. So we're not going to stop till we get that number to all 100% of our schools, but well over 90% now, or over 90% now have reached the 10% threshold, and we're going to continue to go up. In fact, what's interesting now, the vast majority of our schools are getting over 25% of individuals consented being tested every week. So again, and you'll see it in the testing numbers. Last week, which was a 4-day week, we hit the highest number of tests. And what was great, even with that, our positivity rate is at 1.11%. So again, keep in mind the city's rate was just under 5%. We're at 1.11% with more tests than ever being provided across our schools. So again, it continues to indicate very clearly for us, again, cases come into the schools. They don't actually start in the schools. And so again, what's great is that we're continuing to see a decline in our positivity rate. Last week, it was a little over 2.5%. I think it was over 2%. So we're down half from last week with more tests being given. You can see our vaccination rates for staff, one of the highest. We're inching up on 12 and up. I still would like to see that number go higher. We're just under 54%. We are over 60% of our 12 and up do have their first shot, so that gives me hope that we're going to be hitting over 60% soon. But still, it inches up very slow. And then where I am excited and more hopeful is on our 5 to 11s. We're now over 34% of our students now have at least their first shot. That's where we're seeing the biggest momentum. And in fact, almost 150,000 students now have their first dose. So again, we're little by little, I'm hopeful that we're going to get over 50% of our students being fully vaccinated. Oops. And one of the things that was exciting, you can see how many events we've had, vaccination events since July. Also, how many individuals we've actually touched with our vaccination events. But last week, our vaccination events represented 41% of total vaccinations given last week in the city. So between our mobile events, our clinics, we had over 41%. That's the highest we've ever seen as a proportion to the city. So again, momentum hopefully continues to build. And again, I just want to thank our parents who are taking advantage of our events, and I encourage more parents to do so. With that, I'll bring it back to Dr. Luda.
Thank you. Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les voy a estar brindando actualizaciones del COVID-19 en español. Y actualizaremos dónde nos encontramos actualmente. Para comenzar, esta va a ser la 5ª semana consecutiva en que todos los estados y territorios se encuentran en el en el aviso de viajero. Así que recuerden que aun cuando los casos empiezan a disminuir considerablemente, todavía estamos en alto riesgo. Es importante seguir nuestras medidas de prevención y mitigación y, más importante aún, tomar esa vacuna que es tan protectiva y que salva vidas. Actualmente tenemos un promedio de 1.037 casos, 97 hospitalizaciones y una tasa de positividad de 4.5% al día. Recuerden, estamos desdoblando casos cada semana. La semana pasada teníamos el doble, ahora andamos en la mitad. Y así hemos visto que es la trayectoria de lo que es el Omicron aquí en nuestra nación y en el mundo entero. Así que los casos de COVID-19 en Chicago alcanzaron su máximo punto durante el año nuevo y han ido disminuyendo desde entonces. Los números permanecen en nivel de alto riesgo comunitario. Acuérdense, eso es muy importante cuando estamos hablando de flexibilidades y cambiar medidas de prevención y mitigación. Así que es importante seguir los procesos de vacunación para seguir bajando esos casos y poder tener las libertades que tanto nos gustan. La tasa máxima de casos que vimos fue de 9.851 casos que se registró el 28 de diciembre y ahora nos encontramos en 1,000. Esto ha sido increíble en menos de un mes. La positividad de la prueba de COVID-19 de Chicago ha vuelto a bajar a un nivel de riesgo de transmisión más bajo, a pesar del pico que sufrió el 1 de enero, donde su máxima positividad fue de un 20.3%. El ver reflejado todas nuestras métricas en descenso nos dice y reafirma que ya hemos pasado ese punto de la pandemia y nos encontramos en recuperación, pero todavía estamos en un punto donde es importante seguir nuestras medidas de prevención. Las tasas de infección parecen estar disminuyendo. La vacuna sigue siendo altamente protectora contra la infección, aún contra la variante de Omicron, que siempre ha demostrado esa capacidad de evadir inmunidad. Y para aquellas personas que piensan que los riesgos son los mismos, no son los mismos. Todas las estadísticas han demostrado que la vacunación es altamente protectiva, especialmente contra la presentación severa de la enfermedad y la muerte. Las tasas de infección de los no vacunados alcanzaron un máximo de 2 veces mayor que aquellos que recibieron su serie de vacunación completa y sus refuerzos. Si bien las personas mayores siguen siendo mucho más propensas a enfermarse gravemente que las personas jóvenes que se están infectando, hemos visto que nuestros jóvenes de Chicago, especialmente jóvenes no vacunados, han sido hospitalizados con COVID-19 durante este aumento de Omicron y vimos una avidez para los niños de 0 a 4 años que no habíamos visto antes. Así que, por favor, familia, la manera de proteger a nuestros niños es protegiendo a toda la familia, que todos reciban la vacuna, todos aquellos que sean elegibles. Esto incluye a las personas más jóvenes que tienen afecciones subyacentes graves. Con más razón, si tienen familiares enfermos o niños, por favor busquen esa protección adicional tan necesaria para sobrevivir esta pandemia. Las hospitalizaciones por COVID-19 en Chicago están disminuyendo, aunque más residentes de Chicago siguen siendo hospitalizados cada día. El pico total diario de hospitalizaciones se registró el 4 de enero con 276 casos. Los residentes de Chicago no vacunados aún tienen muchas más probabilidades de morir que sus contrapartes vacunadas. Y las tasas de mortalidad de los no vacunados alcanzaron un máximo de 4 veces más que los que están completamente vacunados. Familia, no hay duda de los beneficios protectivos de la vacunación. El 80% de los habitantes de Chicago mayores de 5 años han recibido al menos una dosis. Felicitaciones a todos aquellos que hayan aceptado, que hayan tomado su vacuna, porque ahora de 5 años en adelante vemos un 80% en primera dosis que son protectivas. El 77% de los jóvenes de 12 a 17 y de 18 a 29 años ya han recibido su primera dosis, otra vez 77%, una marca increíble en el avance de la protección de las vacunas y un avance en contra del COVID-19. Finalmente, nos gustaría informar al público que la Fundación Rockefeller ha establecido el proyecto ACT, que ofrece pruebas rápidas de antígenos gratuitas a personas en los códigos postales específicos de Illinois. Por favor, busquen toda esa información, la tenemos disponible y tenemos eso en nuestra página web de chi.gov/covidvax. Hay 225,000 pruebas rápidas de antígenos de COVID-19 que son gratuitas y están disponibles para los residentes de Illinois en 14 condados, que incluye el de Cook. Tenemos 15 códigos postales que van a estar participando activamente de recibir esas pruebas caseras que tan importantes son en tomar y hacer decisiones como parte de un llamado a la equidad, de nuestro lente de equidad. Los residentes elegibles deben visitar www.accesscovidtest.org. Las pruebas están disponibles por orden de llegada. Y cada casa recibirá 5 pruebas dentro de la primera o las segundas semanas después de haber realizado el pedido. Y acuérdense que seguimos vacunando activamente. Nuestros colegios están vacunando todos los fines de semana a nuestros niños y familias y dando los refuerzos. Así que, por favor, para recibir su vacuna, chicago.gov/inclinada covidvax. Y entonces, cuídate Chicago, y también tenemos disponible Protege a Chicago al hogar, que se vacuna gratis, sin gastos adicionales. No necesita identificación gubernamental, ni tampoco necesita aseguranza, con incentivos de hasta $100, 50 por cada vacuna. Muy buenos días, muy buenas tardes a todos. Y le entrego el micrófono a la doctora Arwady. Dr. Arwady.
We got the microphone over there.
Dr. Arwady, a question for you. About 2 weeks ago, you talked about springtime as the likely target of when we might see some of these rules get pulled back, namely proof of vaccination and mask requirement. Given the good news of the last few days, do you see that possibly moving up? And in what is the order of operations that you would tackle the relaxing of those rules?
Yeah, absolutely. So, all along, we have never done it on a date. We have done it on how the outbreak is behaving, right? And I do that in part because I want folks to understand that the decisions that we make are purely based on the numbers that we're seeing, as opposed to a subjective thing that we're working on. So yes, things are looking quite good. We've got to see those move across that page, and there is part of, it's part of a larger conversation across the U.S. as well. As you know, the CDC sets risk levels, and most of those risk levels are based on things like cases and positivity, and we have been part of larger conversations about what is in a long-term kind of way. But I do think, if things continue to look as good as they have been, it could be relatively soon that we'll be doing this. If we're seeing those marching across and we get everything down to blue, or potentially even everything except cases, and things are heading the right way, I want to be able to lift this. I want to be able to lift it, though, at a time that we're confident it won't lead to a major rebound or unnecessarily put more folks at risk. So I don't have a timeline on it, but it is moving quickly, and I'm not changing, I'm not pushing the deadline. We're watching the outbreak, and as we get back down to lower risk, as defined by us, as defined by CDC, we would be looking to lift that vaccination requirement and thinking about the mask requirement for indoor settings as well.
So you said spring last time. You're not modifying that here.
No.
And the key that folks should be looking at is the number per 100,000. 15 is kind of the lock.
So let me kind of step back a little bit. So the 15 per 100,000 per day, all along has been sort of the cutoff for high risk. When you turn that into numbers here in Chicago, that's over 400 cases a day. And that's why we use that 400. That's when we're sort of high. Between 200 and 400 is kind of when we're in that in-between space, and historically under 200 is when we've been low. But the reason we show that chart all the time is that we're looking at cases cases and positivity often, because we're testing so much more than we were early on, we watch that with it. And really those hospital capacity numbers, honestly, are the thing that we are watching kind of the most, and we expect to watch in a long-term kind of way. So we won't be changing metrics, unless there's a change at the CDC level, and we are part of those conversations. I want people to know what to expect, and I expect that as we come off this Omicron surge, that would be the time that we would be lifting those. And I do think that may come a little sooner than I was even anticipating, given how quickly this is moving. That said, we saw the UK flatten out with this potential new thing. Could there be a new variant? You always have to put a few caveats around that, and I know that can be frustrating for folks, but I want people to know that those metrics are set based on how likely it is that when you're out and about, you're gonna come in contact with somebody who has COVID and might not know it. That might be driving spread. We're not going to keep the vaccination requirement just because we like it. We're keeping it because the risk remains higher at this point. I am feeling confident that it will be able to come off relatively soon. And we keep seeing a 50% drop week over week. That could be quite soon.
How can you say that the risk remains higher when it's already down below 5%?
So this is where you always have to look at cases and positivity together. Like if you draw this out to to the most extreme, let's say we were doing 10 tests in the city every day, and one of those were positive, and let's say that's you can drop positivity just by testing a whole lot. That doesn't necessarily, positivity is how many positive tests you have into how many are done total. So it's not just about, I could have a 0% positivity if I did no testing, right? I could have a very high positivity. And we've seen, this has been one of the challenges the CDC has tried to set national standards. We see places where, frankly, people avoid testing because they feel certain ways about COVID, whatever it might be. And so you see parts of the US, counties that regularly sit in the 20, 30% positivity. Generally, the CDC says you've got to be under 10% before we even consider your case numbers to mean anything. And really, you should be under 5%. We test a lot here, though. We always have. And then when you've got places like CPS really augmenting how much testing they're doing, you're adding a lot more, frankly, asymptomatic testing into that, which also will drop your positivity. More testing means lower positivity. And so you have to look at those together. It's not just getting to kind of one or the other. But the larger point is that I think the cases and the positivity in a long-term way, not for coming off Omicron, but in a longer-term way, the health department has already been doing a lot of planning about what does it look like to follow this long-term, to think of this as one of many respiratory diseases, to make sure we're tracking for variants, looking for serious outcomes like we do for flu. And we're going to be talking quite a bit more about this. It's what I'm dedicating my Facebook to on Thursday. But all to say, it's sort of a tricky time as things are moving, but I do think we're in a pretty good place. And that is largely because most Chicagoans have gotten vaccinated, and we need more folks to do that.
All right. Mr. Martinez, can I have a question to you, please? I received an email from someone who works for CPS in administration who tells me that this person is required to get the booster and has been told if we have a medical exemption, we will need to apply for an unpaid leave of absence. Why is that?
So we're definitely going to be asking staff. First of all, we've had our vaccine mandate in place already. The definition of being vaccinated has changed from the CDC for boosters. So we are asking staff to get boosters. I don't have the particulars yet on what dates I don't think we've given a date yet to staff. And it's mainly because you saw from the new CDC guidelines, in order for staff not to be quarantined, we actually need them not just to be vaccinated, but to be boosted as well. And then we'll work with staff who have medical waivers and religious waivers. So I'll look into that in a little bit more detail. So let me look into that.
Is it accurate that you must have, that if you ask for a medical waiver, that you are going to be put on unpaid leave?
Let me find out. Let me ask that question directly to our benefits staff. But right now, we are encouraging staff definitely to get their boosters.
Got it. I forgot one more for Dr. Arwady, please. The city gave out its vaccination rate, or the requirement. Everybody was to have it done by yesterday. And do you have any idea what is happening to those who did not follow through and didn't do anything? Are those people still working for the city of Chicago?
So I'm not going to speak for the whole city. That would really be the Department of Human Resources that has been leading on this, and there's different pieces. I can tell you at the Chicago Department of Public Health, as you would expect, the very, very huge majority of people are fully vaccinated and boosted. We did have a few people not get vaccinated, not have a approved medical or religious exemption, and those people are on non-disciplinary no pay status. And I, particularly for medical care, there are some other reasons for us to do that, because we can't, Medicaid, Medicare, et cetera, you actually cannot have unvaccinated people in healthcare settings. So even outside of the city's requirement, we would have had that as a requirement as the health department. But yes, there are folks that have moved on to non-disciplinary status, and my hope is that they will change their minds and get vaccinated, but they are actually unable to do their jobs, particularly at the health department right now. And so I know that similar things have happened in other departments. I'm not going to speak to the whole city. There are still a few folks, just to put a little detail on it for the health department, there are a couple of folks who, there's someone who had gotten vaccinated, but still after all this time had not submitted her paperwork, and so that's getting checked. We had somebody who has been on a long-term medical leave, and we're sorting that out. So there's still a few folks around the edges that we're working on, but yes, at this point, people have really run out of time, and we have taken action, and that has been the direction, I know broadly, and I'm not going to speak to the details of all the departments.
How many do you know in your department?
I will say, I don't want to kind of out people too specifically. We have fewer than 5 people who are on a no-pay, non-disciplinary status at this time.
I have a question for Dr. Martinez. Under the winter storm advisory, does CPS have plans to close schools or shift to remote learning Wednesday? And just trying to get a sense of what conditions would cause CPS to close schools.
So we're actually monitoring that very closely. I was hoping to be able to have a decision by this event, but we're still monitoring the weather. So what we're watching for is, and I'm seeing a little bit of inconsistencies of how hard we're going to get hit in the city itself. And for us, we look at if we see a risk of over 8 inches of snow, and also couple that with the timing of when the city would be able to clean out the streets, because we have, so many of our parents are dropping off children, our buses also, our vans. And so we're going to be watching that. I'm hoping that we make a decision very soon. I know it always pains me, because I know parents will be waiting, but my hope is we make a decision well before the evening hours, so hopefully late afternoon. So we're watching the weather, but that's what we're watching for, is the accumulation of snow, the timing of when that snow is going to drop, and then the likelihood of our streets being able to be cleaned in time to deal with all the traffic.
Has CPS instructed administrators to send devices home?
So what we, our staff are always, because, they've been here in Chicago for a long, the good news is we have devices in all the schools. Principals always know whenever there's a risk, either have devices or home or work prepared. So, they're always on notice for that, especially during these months. So, but we've asked staff to sort of, be on hold right now until, again, as we monitor over hopefully the next couple of hours.
And has CPS made a decision about makeup days for the teacher walkout, and how many days is CPS short of the state requirement?
Yeah, so I'll answer the latter. So right now we still have 2 snow days that we have for the year without having to make up days. And what I've said in terms of any makeup days, really what I'm going to look at is really the academic needs of the children. We have, state assessments that all of our children will be taking for the first time district-wide, because last year less than half of our students had to take state assessments. We have, SAT assessments. We have other high-stake assessments that children. So what we're going to be doing is just working with our schools, mapping out the rest of the semester. We should start a second semester, mapping out the second semester. And then really for me, I have no doubt that children have academic needs. So it could be, for example, asking schools to develop a plan. It could be Saturday programs, after school programs. So those are the things that we're going to be developing over the next month or so.
Thank you all for coming.
Thank you.